Welcome back to the Deep Dive. Today, we're taking a look at some promotional and informational material from a really highly rated dental group in North Dallas.
Right.
And we're going to use it to build a kind of detailed blueprint. Our big topic is, what does comprehensive dental care actually mean today in a top-tier practice?
That is exactly the mission. We're trying to move way past just, routine checkups and cleanings.
Yeah.
The goal is to pull out the essential pieces of modern dentistry. We're talking everything from sophisticated prevention all the way to highly specialized health treatments. And we're using this North Dallas group's offerings as a benchmark for what you, as a well-informed patient, should expect.
And we picked this material for a reason. It sets a really clear standard. This isn't just some abstract list of services they offer.
Where it's not.
It shows you what your expectations should be. I mean, this is a practice that's been recognized for excellence.
Yeah.
They specifically mention having 3 doctors named among D Magazine's 2025 Best Dentists.
Right. Dr. Goff, Dr. Contrucci Ruiz, and Dr. Reifer.
Exactly. So knowing what a practice at that level offers, it lets you benchmark your own dental health expectations going forward. Okay, so let's unpack this. Let's start at the core. Before we even get to crowns and cavities, what's their stated philosophy of care? What's the identity that anchors them?
Well, their philosophy is what ties everything else together. And it seems to be twofold: expertise and empathy.
Okay.
If you look at their why choose section, they immediately emphasize having an experienced and skilled team. But the critical point here is the commitment to continuous learning.
So not just resting on their laurels.
Exactly. Staying up to date with the latest advancements in technology, in techniques. It's not just about having good dentists. It's about having guides who are constantly refining their craft.
And that recognition we mentioned speaks directly to that skill level. It's critical.
Yeah.
We should also mention Dr. James Reisman is part of that core team as well.
Right.
But let's talk about the other half of that commitment, the human element. They highlight a patient-centered approach in a field that's becoming so, tech-driven. Why is that so important?
Because advanced dentistry isn't just mechanical. It's often deeply personal. It can be really complex.
Sure.
So if a practice commits to treating you with respect and creating a comfortable, relaxing atmosphere, that means they're prepared to handle anxiety. They're ready to discuss uncomfortable procedures, honestly.
So trust.
It's all about trust. A patient-centered practice gets that the best clinical outcome requires that cooperation. That commitment to comfort is what allows them to even use the full spectrum of services they offer.
Speaking of which, the source mentions their use of state-of-the-art technology and equipment. That sounds good on paper,
Right.
But what does it actually do for a patient?
The technology isn't just a gadget. It's really the engine of precision and efficiency. A commitment to state-of-the-art equipment translates directly into quicker, less invasive procedures, more precise diagnosis. For you, the listener, this means faster healing, less time in the chair, and often much more predictable results.
So it bridges their skill with their dedication to comfort.
That's the perfect way to put it, yes.
And if we connect this to the bigger picture, that whole framework, technology, and comfort, it basically frames the necessity of their huge service list. They can't just be skilled in one little area if they're truly comprehensive.
Exactly. If you market yourself as a comprehensive solution, you have to be able to address issues that span aesthetics, functionality, and even systemic health. This level of commitment ensures they can deliver personalized care, whether you walk in for a routine cleaning or for a really complex multi-stage restoration.
Okay, let's transition into those specific categories, starting where all good health starts. Oral hygiene. What services are listed here, and what's the difference between just maintenance and true preventative care?
The foundation is always going to be professional teeth cleaning, but comprehensive care goes deeper.
How so?
They list gum disease, prevention, and treatment. That's a crucial distinction. Prevention is your routine maintenance.
Right, the checkup.
Treatment implies intervention. If you have active periodontitis or even advanced gingivitis, you need specialized work like scaling and root planing, which is way beyond a typical cleaning. That requires a dedicated approach.
So the inclusion of active treatment shows they handle more than just the basics. Okay, moving from prevention to enhancement. Let's talk cosmetic dentistry. This is an area that can sometimes feel like it's just about vanity. How do they frame it?
Well, cosmetic procedures obviously contribute to confidence, which is a key part of well-being, but they often have underlying functional benefits too.
I see.
They offer the classic treatments: professional teeth whitening, dental bonding. But they also provide more transformative options like dental veneers, which can correct minor alignment and spacing issues, not just discoloration.
And what about the popular clear aligners?
Yep, they specifically list Invisalign, and that's a perfect example. The outcome is cosmetic, but the function is fundamentally restorative. It corrects malocclusions, bite issues, things that can lead to long-term wear, pain, and damage if you don't treat them.
Right.
And when you look at all the material together, it confirms they integrate all of this preventive, cosmetic, and restorative, and they use modern methods. They even note laser dentistry in their FAQs.
Okay, let's pivot to restorative treatment. This is where the deep dive into functionality really begins. For the listener who has suffered damage or decay, what are the key procedures listed here?
This is where the skill of the practice really becomes visible. They list the core fixes, dental fillings, and then the more heavy-duty structural solutions like crowns and bridges.
Okay, so crowns save a compromised tooth, and bridges replace a missing one.
Right, by anchoring it to the teeth next to it. It's a very common solution.
But the real functional game changer listed here seems to be dental implants. Why were implants considered the gold standard, and why is that inclusion so critical for a practice to be called comprehensive?
Implants are functionally superior because they mimic the natural tooth root. That's the key.
What do you mean by that?
Well, when you lose a tooth, the jawbone underneath starts to atrophy. It just wastes away because nothing's stimulating it.
Yeah.
Dental implants are surgically placed into the jawbone, and that provides the stimulation it needs to prevent bone loss. A traditional bridge just sits on top of the gums. So including implants means the practice is focused on your long-term structural health, not just a quick fix.
And the final cornerstone of restorative care they list, root canals. What does their inclusion tell us?
Root canals are necessary to save a tooth that has deep decay or an infection in the pulp. And while they have a scary reputation, modern root canal therapy is highly effective and honestly far less painful than it once was.
So offering them in-house is a big deal.
It is. It means they're committed to saving your natural teeth whenever possible, rather than just immediately resorting to extraction. And that requires a lot more expertise and better technology to do successfully.
Now, moving beyond general repairs, let's talk about specialized treatment. This is where the practice really shows its range, offering solutions for health issues you might not even realize your dentist should be handling.
This is absolutely where the term comprehensive is earned, because they're bridging oral health and your systemic well-being.
How so?
They specifically offer diagnosis and treatment for temporomandibular joint disorders, or TMJ.
TMJ, right? That can be debilitating.
Oh, you really can. These are chronic pain issues, often caused by bite alignment or clenching, and they can show up as headaches, ear pain, jaw stiffness, things you wouldn't necessarily connect to your teeth.
And second, they get into sleep health, which is a massive issue for overall health.
A huge issue. They offer custom oral appliances for treating obstructive sleep apnea. Yeah, and this is crucial knowledge for you, the listener. A lot of people just can't tolerate a CPAP machine.
Right.
The dental solution is a custom-fit appliance that subtly repositions your lower jaw and tongue while you sleep, which keeps the airway open. The fact that a dental practice is tackling chronic pain like TMJ and a life-threatening sleep disorder, that shows a really high-level integration of medical and dental knowledge.
And what if something happens suddenly? An accident or an infection?
Yeah.
What about emergencies?
They confirm they have availability for dental emergency care to address urgent problems like sudden tooth pain, broken teeth, infections, that kind of thing. And having all of that specialized treatment and urgent care under one roof is really a hallmark of a comprehensive center.
Okay, so understanding the depth of care is one thing, but we know the biggest barrier for so many patients is anxiety.
Dental fear is real.
So let's explore the comfort and sedation options. This brings us right back to that patient-centered philosophy we talked about at the start.
And their commitment here is impressive. They offer 3 distinct levels of sedation to accommodate everyone from, someone with mild nervousness to someone with genuine dental phobia.
What's the first level?
The most common and the lightest is nitrous oxide or laughing gas. It's inhaled, it's very safe, and it's effective for reducing anxiety and discomfort during shorter procedures.
And for those who need a bit more relaxation, maybe for a longer appointment.
That's where oral sedation comes in. It's a medication you take orally before the appointment. It puts you in a really relaxed, drowsy state, but you're still conscious and responsive. It's excellent for moderate anxiety.
But the highest level, the one that really shows they're ready for complex cases, is the inclusion of IV sedation.
Precisely. Forced sedation is a much deeper form of relaxation, administered intravenously. It puts the patient into a profound state of relaxation. It's ideal for lengthy surgeries, complex implant placements, or for patients with extreme dental phobia. The fact they offer this, which requires specific training, certification, and dedicated monitoring equipment, it just reinforces that they're set up to handle the full spectrum of care and patient needs.
And that full spectrum of care is tied to accessibility, right?
Yeah.
Let's quickly go over the logistics. For people in North Dallas, where is this practice located?
They're located at the Medical City Dallas campus, so it's very easy to access. The address is 7777 Forest Lane, Suite C104.
And what about office hours? That can say a lot about how patient-focused a practice is.
The hours are Monday through Thursday, from 7:00 a.m. to 3:00 p.m.
That 7:00 a.m. start time is a clear signal.
It is. It's an accommodation, letting people get care before starting a standard workday.
And if you have a severe urgent issue, a broken tooth or a bad infection, can you get in quickly?
They say that same-day appointments may be available for urgent needs. And their advice, which is good advice for anyone, is to call the office as early in the day as you can for the fastest help.
Okay, and finally, let's address the elephant in the room. Cost. Advanced care isn't cheap. Do they address that financial barrier?
They do. They specifically confirm they have flexible payment plans and financing options available. And this is a necessary service for any truly comprehensive practice. It ensures that patients who need complex treatments aren't blocked by the initial investment.
And they welcome new patients for all levels of care.
Yes, preventative, cosmetic, restorative, or specialized, they make that clear.
So when we boiled it all down, what does this deep dive really tell us? The main takeaway seems to be that modern, high-standard dental care is not just a siloed set of tasks.
It's absolutely integrated. We've seen that true comprehensive care merges preventative health, your hygiene and disease management, with aesthetics like veneers, and with complex restoration like implants.
But the key differentiator seems to be that next level.
Right. The inclusion of specialized medicine, the ability to diagnose and treat systemic health issues like TMJ and sleep apnea, while guaranteeing deep patient comfort through options like IV sedation. That's the difference.
So the key takeaway for you, the well-informed listener, isn't just knowing these services exist. It's understanding that the commitment to specialized treatments, combined with sophisticated comfort measures like offering multiple levels of sedation, indicates a truly high standard of care.
Yeah, a standard you should insist on. This kind of practice is using the mouth as a gateway to overall health. They view your oral health as intrinsically linked to your whole systemic well-being. They're not just looking at your teeth, they're looking at your whole head, your neck, even your sleep cycle.
Which leaves us with a final provocative thought for you to chew on until next time. Given the treatments for chronic issues like sleep apnea and TMJ disorders are now routinely offered at a comprehensive dental practice, what unexpected connections might exist between your seemingly unrelated general health symptoms, things like persistent tension headaches, chronic neck stiffness, or debilitating daytime fatigue, and your oral health that you haven't explored yet, something to investigate on your own.